helping you live healthy. According to the American Heart Association, more than 30 million Americans are dealing with various forms of heart disease. Some also face another health challenge at the very same time, a diagnosis of cancer. Many of these patients benefit from a medical specialty called Cardio-Oncology. And joining us now is cardiologist and oncologist from Mayo Clinic, Dr. Jordan Ray. Thanks so much for being with us this morning.
Absolutely. Thanks for having me.
The first question I have for you is, how are these two ailments related? Why do they go together?
That's a very good question. We know that there are certain malignancies like breast cancer that are actually associated with cardiovascular disease. Some of the common risk factors that lead to both occur in patients, and we traditionally see a lot of cardiovascular disease in some of those malignancies. Likewise, some of the cancer therapies that we give to patients can have some toxicities to the heart, and we're starting to recognize that even more now and providing some proactive strategies to help patients go through both.
So I'm sure you're talking about chemo here and the connection to heart problems when someone goes through chemo. What kinds of things can you now do to help prevent problems?
So the big thing is prevention and recognition of some of the conditions that can occur. We know that traditional chemotherapies for patients who are experiencing breast cancer, lymphomas, some of the sarcomas, can be very toxic to the heart and can lead to heart weakening. And then some of the newer medication strategies that we have are actually immunotherapies, where we're turning the immune system on to fight cancer. And unfortunately, sometimes that can have adverse effects on the heart muscle itself. So prescribing a monitoring program, recognizing some of the risk factors for patients. And a big part of my job is actually education for the patients, talking about their traditional cardiovascular risks and trying to modify those before therapy and prescribing some type of monitoring program during therapy.
So if you're a cancer patient watching right now, or someone you love is, are there certain questions that they should be asking their oncologist?
I think so. I think it's important for patients who are experiencing cancer therapies to make sure that their oncologist has talked about the cardiovascular risks associated with their therapies. When it comes to radiation therapies, it's important to discuss with their radiation oncologist the amount of radiation that they expect the heart to see and the structures of the heart that may be in the way of the radiation, because those are important things to follow up, especially with radiation, where if the heart sees radiation, a lot of the effects of radiation heart disease can be delayed up to 10 or 15 years before we notice or recognize them.
Now, what if you're a long-term survivor of cancer? Are there any risks there?
Yeah, there are some risks, but they're a lot smaller than patients who are experiencing the chemotherapy at that moment in time. More importantly, I think, and another half of my job is seeing cancer survivors, because we're getting so much better at treating cancer. The long-term outcomes in cancer are so much higher that not focusing or recognizing a traditional cardiovascular disease sometimes gets overshadowed. So we are seeing, for instance, women with breast cancer who have exceptional survivable rates having cardiovascular events because we failed to recognize they had cardiovascular disease before. And so I very much take seriously that aspect of things. It's very unfortunate for us to have patients go through cancer therapy, survive their cancer, and then end up with a cardiovascular event later on in life.
Is that a relatively new specialty, cardio-oncology?
Yeah, I think so. There have been a few cardio-oncologists, as we call them, throughout the country for maybe about 15 years. But now we're starting to have an infrastructure in place for specialized training. There are documents now that we've written kind of describing what constitutes an appropriate training level for providers who want to consider themselves in this area of specialty. So really the last 5 years it's grown. And in the last 2 to 3 years, we've seen a big spike in education, a big spike in motivation from the oncology world to support these types of clinics.
Fascinating field of study and so important. Dr. Jordan Ray from Mayo Clinic, thank you so much for being with us this morning.
Thank you for having me.